Hello everyone, I'm Fakhar Fatima Mahawina, student of MSc Clinical Nutrition and Dietetics first year. I'm going to speak about WHO standards of anthropometric measurement. What is anthropometry? It is the study of measurement of human body in terms of dimensions of bone, muscle and fat. Before we get into the topic, let us know what comes under anthropometric measurement. First is height measurement. The subject stands erect on the stadiometer. The movable headpiece is leveled with headboard. The height can be read from the stadiometer scale. For infants, infantometer is used for infants below 2 years of age. Second is weight measurement. It can be used to assess infants, children, pregnant women and adults. Uses a regularly calibrated electronic or balance beam scale measured in light clothes nearest to 100 grams. Third is mid-upper arm circumference. It is the circumference of the right upper arm measured at the midpoint between the tip of the shoulder and the tip of the elbow, known as olecranon process and the acromion process. Fiberglass tape, which does not stretch, is used to measure mid-upper arm circumference. Fourth is skin fold thickness. Skin fold thickness is measured by skin fold calipers like Harpenden and Lange. It measures the thickness of the skin and subcutaneous fat using constant pressure applied over a known area. Common sites are triceps and in the subscapular region. It has value in assessing the amount of fat in the body. Fifth is head and chest circumference. A newborn's head is usually about 2 cm larger than the chest size. After 2 years, the chest size becomes larger than the head. Between 6 months and 2 years, both measurements are about equal. This table shows values for head and chest circumference for both boys and girls of 1 month to 1 year. For example, the boy who is 1 month old has 37 cm head circumference and 36 cm chest circumference. When he is 1 year old, it's 47 for both head and chest circumference. Next is WHR, waist hip ratio. Waist measurement, measured at the level of umbilicus nearer to 0.5 cm. Subject stands erect with the relaxed abdominal muscles, arm at the side and feet together. Measurement taken at the normal expiration. Hip measurement, measured at the point of greatest circumference around hips to nearest 0.5 cm. Close contact with skin without indenting soft tissues. Subject should be standing and measurer should be beside them as given in the picture. Interpretation of waist-hip ratio. Higher risk of waist-hip ratio is 0.8 in females and more than 0.95 in males. It indicates central obesity and consider high risk for diabetes and CVS disorders. For example, a person with 76 cm waist and 97 cm hip has a waist-hip ratio of about 0.78. Now, let us move on with the topic. Who is WHO? World Health Organization is a specialized agency of the United Nations responsible for international public health. Founded in April 7, 1948, it is headquartered in Geneva, Switzerland. Its main objective is the attainment by all people of the highest possible level of health. The WHO's broad mandate includes advocating for universal health care, monitoring public health risks, coordinating responses to health emergencies, and promoting human health and well-being. What are Z-scores? The World Health Organization uses Z-score to assess the nutritional status of individuals. Z-scores, also known as standard deviation (SD), is the measure of the distance between the child's value for the reference population. Z-score of 0 corresponds to the reference median or average. Z-score of +2 indicates upper end of normal range. Z-score of -2 indicates lower end of normal range. Formula of Z-score. Observed value minus median reference value divided by standard deviation of reference population. -2 to +2 is considered as normal, -2 to -3 is moderately malnutrition, less than -3 is severe malnutrition, and +2 to +3 is overweight, and more than +3 is obesity. Moving forward to WHO standards of anthropometric measurements, it includes length or height for age, weight for length or height, BMI for age, head circumference for age, arm circumference for age, subscapular skin fold for age, and tricep skin fold for age. First standard being length or height for age. This measurement is used to assess the growth of a child in relation to the expected weight for their age. Z-score charts for girls and boys from birth to 5 years of age. Age is on x-axis and height is on y-axis. 0, that is in green line, has normal value, and +2 and +3 show upper range, and -2 and -3 show lower range. Second standard being weight for age. This measurement is used to assess a child's physical development in relation to their age. Z-score chart for weight for age for girls and boys from birth to 5 years. In this chart, age is on x-axis and weight is on y-axis. Third standard being weight for height. This measurement is used to assess a child's physical development in relation to their age. Z-score charts for weight for height for girls and boys from birth to 5 years of age. In this chart, height is on x-axis and weight is on y-axis. Fourth standard being BMI for age. This measurement is used to assess a child's overall nutritional status in relation to their age. Formula of BMI: weight in kilograms divided by height in meters square. Z-score charts for girls and boys from birth to 5 years of age. x-axis has age on it and BMI is on y-axis. 0 indicates the value of normal ranges, and plus 1, 2 and 3 indicates the value of upper ranges, and minus 1, 2 and 3 indicates the value of lower ranges. Next standard is head circumference for age. This measurement is used to assess a child's brain development in relation to their age. Z-score charts for girls and boys from birth to 5 years of age. Age is on x-axis and head circumference is on y-axis. Similarly, 0 indicates the normal values, and plus 1, 2 and 3 indicates upper ranges, and minus 1, 2 and 3 indicates lower ranges. Next standard is arm circumference for age. This measurement is used to assess a child's arm muscle area in relation to their age. Score charts for arm circumference for age for both girls and boys from 3 months to 5 years of age. Age is on x-axis and arm circumference is on y-axis. Next standard being subscapular skin fold for age, which comes under skin fold thickness for age. This measurement is used to assess a child's fat distribution in relation to their age. In the Z-score charts for both girls and boys from 3 months to 5 years of age is on x-axis and subscapular skin fold is on y-axis. Last standard being triceps skin fold for age. This also comes under skin fold thickness for age. This measurement is also used to assess a child's fat distribution in relation to their age. Z-score charts for both girls and boys from 3 months to 5 years of age is on x-axis and triceps skin fold is on y-axis. With this, we come towards the end of the video, and I would like to conclude it by saying the purpose of the standards. Healthcare providers can assess an individual's health and determine if they are at risk for certain diseases or health issues. They are used to assess a child's growth and development and used to diagnose and manage malnutrition. Thanks for being till the end.